Hello cruel world, my name's Dr. Das, I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living, so you don't have to. Daniel Gonzalez was a spree killer. He murdered 4 people and he injured another 2 in September 2004 when he was aged 24. Gonzalez was diagnosed as suffering from schizophrenia around the age of 18 and he eventually committed suicide in Broadmoor Hospital in August 2007. He used like a broken CD case to cut himself and bleed to death. So what motivated Gonzalez to go on this random killing spree? Why did he kill himself? And how are severe deliberate self-harm and suicide dealt with in Broadmoor Hospital? I'm going to answer all of those questions and more in this video. This is a series that I'm doing of about 6 or 7 real-life patients from Broadmoor. I'm going to give you my professional insights and my theories as a forensic psychiatrist. I actually worked in Broadmoor myself as a middle grade psychiatrist around 7 years ago. This channel, A Psych for Sore Minds, dissects a whole range of mental health issues, some related to violence, some more recognizable and common for the average person. I talk about some high profile cases, I talk about individual diagnoses, I interview ex-patients. There's something for everybody on this channel. So I've already done videos on Robbert Maudsley, who's an English serial killer, Ronnie Kray, who's like a celebrity gangster who's got schizophrenia, David Copeland, who set off 3 nail bombs in London in 1999, Robert Napper, who is like a serial murderer and a rapist, and Charles Bronson, who is a notorious prison thug. So these are all patients who have been in Broadmoor Hospital at some point in their lives. Go check them out if you're interested. I dissect some other aspects of what happens in Broadmoor and in high secure hospitals. So Daniel Gonzalez, let's first talk about his crimes and then his backgrounds, and then I'll give you my theories of my professional psychodynamic formulation. So in mid-September 2004, Gonzalez went on this 3-day killing spree in London and in Sussex. He apparently fantasized about copying the character Freddy Krueger from Nightmare on Elm Street. And he told police later on that he intended to kill 10 people as a kind of version of this fictitious child killer. His attacks were senseless and they were random. And on the 15th of September 2014, what happened is that Gonzalez told a random 61-year-old man who was walking his dog with a wife for directions and then told him he was going to kill him. This man managed to fight him off and Gonzalez fled to 𝐏𝐸𝐻. And in 𝐏𝐸𝐻, he stabbed a 76-year-old woman named Marie Harding whilst he was wearing a hockey mask. And after all of that, he returned to his home area in Woking. Then 2 days later, Gonzalez travelled to Tottenham, which is in sort of north central London, near where I live. And at 5:30 in the morning, he left a 46-year-old man called Kevin Molly for dead after stabbing him in the face and the neck and the torso with a large pair of kitchen knives, which he had stolen from his department store. And then he went to Hornsey, which is quite nearby, at 7 o'clock, and he forced entry into the house of 𝐘𝐻 Constantino, but then he was fought off after stabbing this man in the arm. And by 8 o'clock in the morning, he went to 𝐿𝐴𝐽𝐳, where he tried to gain access to random houses, and he murdered an elderly couple named Derek and Jean Robinson. So his crimes were just dramatically senseless, random, horrific. Let's have a look at his background. So Gonzalez had an English mother and a Spanish father, and he was educated in a private school. He was apparently a talented actor. He was a chess champion. So already he's demographically very different from the patients that I see within forensic psychiatry. So usually most of my patients have a background of poverty or abuse. Gonzalez was bored, he was unemployed, he had no friends, and he was using a lot of drugs. And he spent entire days watching horror films and playing computer games. And he lived with his mother in their home in Woking, which is in Surrey. What I think is quite interesting about this case is that Gonzalez was actually diagnosed with schizophrenia earlier on in his life when he was around 18, and he was treated for a time by psychiatrists, but the treatment wasn't successful. At that point, there was no concerns about his potential for violence. Now, I would really like to stress that the vast majority of people with mental illness, including schizophrenia, are categorically not violent, and it's only a very small proportion, but those are the people that I see working in forensic psychiatry. And so when he was risk assessed at the age of 18, he didn't mention any kind of intentions for violence. He wasn't violent in his outlook or his manner or his actions. So at that point, I think his risk assessment would have been unremarkable. You can't just assume that people with symptoms of mental illness will be violent. So you can't preempt violence that's not kind of indicated or telegraphed. So my psychological assessment of him is the following. I should stress that obviously I've not assessed him in person, so these are all theoretical. So we know that Gonzalez had a diagnosis of paranoid schizophrenia, and we know that he wanted to kind of encapsulate the character Freddy Krueger from Nightmare on Elm Street. So I think maybe in his mind, what was going on was not real. So in his mind, there was no consequence to his actions. So of course, many people who play video games and watch films might fantasize, but they don't act on these fantasies, they don't become violent. And I think that Gonzalez couldn't distinguish reality from fantasy, and his schizophrenia probably contributed to this, because that's renowned for stepping outside of reality, having beliefs that are not true, which are delusions, or having experiences such as hearing voices which do not exist, which are hallucinations. But I think vitally in this case, it wasn't just that. I think it was also because he was isolated, didn't have any friends, didn't have any contact with the outside world. So because there was no outside influence, I think it cemented his bizarre fantasies. There was nobody to challenge his thoughts. And then on top of all of that, he was using drugs heavily, which, as we know, can disinhibit certain people and can make them violent. Moving on, I think another aspect that's fascinating about Gonzalez's story is his arrival at Broadmoor. So there was a large number of police officers in riot gear, which is exceptional. And he needed to have constant observation. So he had to have 2 nurses at arm's length away from him in Broadmoor for 18 months. And this is very, very, very rare. So when I've seen constant obs in secure hospitals, it's usually been one nurse, and it's usually for a few days while the patient is agitated until they can be calmed down with, for example, medication and sedatives. To have 2 nurses, I've seen that, but it's unusual, but never for 18 months. I think the longest I've ever seen is about a month. So that indicates to me that he was extremely dangerous, extremely risky, extremely violent constantly. He couldn't even be left alone. The other thing I'd say is that's very resource heavy. So if you're having 2 nurses that have to be with him constantly, then they can't provide care to other patients. So the next interesting question, I think, is why did Gonzalez kill himself? Well, whilst he was awaiting trial, whilst he was at Broadmoor Hospital, so he hadn't yet gone through his court case, he tried to bite himself to death, pretty gruesome, and he survived this, but eventually managed to commit suicide in Broadmoor in August 2007 using a broken CD case. And I wonder whether it was a form of depression probably brought on by guilt. So he almost certainly would have been treated for his psychosis, so possibly over time his psychotic symptoms were gradually resolving with treatment. So now there were consequences to his actions. Now he realized that what reality was, and he couldn't escape into this alternate fantasy world because he was no longer in psychosis. And this is actually very common in the patients I see and rehabilitate. Obviously, the vast majority don't have such a violent index offense, but I've certainly seen people who've hurt family members who were, when they were psychotic, then get better, and then they're just full of this embarrassment, grief, shock, shame, and this has to be treated if it turns into depression. You can use antidepressants, although obviously that doesn't change the root cause. It can just take the edge off some of the symptoms. So the next question is, how does Broadmoor as a hospital prevent self-harm and suicide? Well, there's the obvious things. So you remove items that people can self-harm with, like CD cases. Obviously, he somehow managed to get access to one anyway. Broadmoor and other secure units have unmovable, specialized furniture that's really hard to grip and hard to pick up. So you can't use it to hurt yourself or to hurt other people. You can have them on constant observation, although that's not really a long-term fix. And as I said before, you can treat the depression with medication and with psychological therapy. The other thing that we do is that we show compassion for people who the rest of society reviles. And I think this is fair to say, this is maybe a concept that some people struggle to wrap their heads around. Sometimes they just want the perpetrator to suffer. And I can understand this point of view, especially in a case like this where there's been especially horrific and senseless killing. So even though I appreciate this perspective, I'm a doctor, I'm not a judge, I'm not a prison officer, so my perspective has to be different, regardless of my personal emotions. So how long do patients stay in Broadmoor Hospital? Well, there's not really a direct answer to that because it's taken on a case-by-case basis and it depends on their kind of recovery journey. So it's more about landmarks than it is about time. So for example, if the virus was only related to mental illness, then the main aim would be to cure this mental illness. So some people with psychotic symptoms can react quite quickly to medication and the process is quite simple. But some people are treatment resistant, which means that it might take months or even years to get the medication right, because you have to try lots of different doses, you have to try different combinations of antipsychotic medications. Most of them take at least 4 to 6 weeks minimum before you even see whether they're working or not. So it's quite a complex, convoluted assessment and activity that you have to do. And then on top of all of that, they go through deep psychological therapy, and that's to help the patient gain insight into their symptoms so they can recognize them in the future. And because remember, you you have to realize that their beliefs and their voices feel real to that person at that time. And the therapy might also be about what you do to prevent relapse in the future. So you have to analyze the factors and the circumstances which made them unwell initially. So that could be drug and alcohol rehabilitation. It could be thinking about putting themselves in situations where they reacted with violence, say particularly unsavory characters that have triggered violence and relationships in their lives that they need to cut out. So the reason that the length is variable is some patients refuse to engage in this kind of therapy, or they're too mentally unwell to do it, so it takes longer. And then on top of all that, you have to look at the patient's behaviour and on the wards and whether they stick to boundaries. So if a patient is constantly fighting or arguing, then they're probably going to be deemed to be riskier and they're going to be in hospital for longer. And there are other types of therapy rehabilitation. So I said before that it's all about landmarks. So one landmark is to be symptom-free of your mental illness, and then you can start your therapy. Another landmark would be completing all the necessary therapy. Another landmark might be no violence on the ward. For a very serious case, it's usually for something like 6 months. So if all of these things happen, then the next thing that can be considered is leave into the community. So obviously this is a big step for a patient who's deemed quite risky. So first it's escorted leave. So a nurse goes out with the patient, and then if that all goes well, then you can have unescorted leave in the future. And obviously that's a huge step. So generally speaking, all leave happens from medium secure units. Generally, people don't have leave from high secure. They have to go through lots of rehabilitation, be safe, then medium secure where they might have leave. There are exceptions. If people engage extremely well in their therapy and their symptoms have gone very quickly, which is unusual, then you can actually get leave from high secure hospitals like Broadmoor. So realistically, all of that rehabilitation to step down to a medium secure unit, the quickest realistic time frame is about 2 years, although it can be much longer. It can be for decades, and about a quarter of all patients in high security stay in hospital for 10 years or more. And I have to say, sadly, there are some patients who will never leave secure hospital. So I've worked with people in Broadmoor who are so unwell that their mental illnesses are just not likely to respond anytime soon. They might spend the rest of their lives there, even with powerful drugs. So to go back to the case of Gonzalez, to conclude, it was just a horrific, senseless case, completely random murders. It's everyone's absolute nightmare. He then commits suicide. I think probably there's going to be a lot of people maybe watching this video who are happy with that fact, or at least feel content or a sense of closure because of what he did. I can understand that viewpoint. For me personally, if I take away the morality and the ethics and look at it just clinically, I think it's a shame, because we never really got to analyse him properly. We never really got to know what his motivations were, never got a good grip on any symptoms he had and whether they directly drove his violence specifically. So I'm going to tell you what's coming soon on A Psych for Sore Minds. Before I do that, I want to shout out to my boy Joshua Miles, who is a true crime YouTuber. Go check out his videos, show him some love, subscribe to his channel. He's got lots of fascinating videos, and what I like about his content is that he scours for sources that are hard to find, and his in-depth analysis goes deeper, I think, than many other similar channels. So I'm going to tell you about the next episode, but I just want to share with you some news, which you'll probably know if you watch my other videos, which is that I'm going to be a speaker for CrimeCon UK. It's a big true crime convention in the UK. It's huge in the States, coming over to the UK for the first time ever on the 25th and 26th of September in London. You will hear about serial killers and unsolved crimes. You will hear from criminologists, law enforcement agencies, and your favourite podcasters. I'm going to be doing a talk about 2 real-life cases of people that I've assessed who've killed their own family members. So one was mentally ill, went down the hospital route, one wasn't, went down the criminal justice route. If you truly are a true crime enthusiast, then you have to cop tickets. Use the link below and put in the code PSYCH to get 10% off your ticket. Coming soon on this channel, I've got a few things planned. I'm going to be answering more questions from the internet. If you've got any questions for me, please email me. And I'm also going to be looking into Munchausen's and Munchausen's by proxy. You've probably heard of these diseases. It's where somebody either fakes a mental illness for their own attention and compassion for other people, or they put this onto another vulnerable person, usually their kids. There are a couple of high-profile murder cases related to this, and I'll be discussing them. Please subscribe to my YouTube channel. Not only does it help me out immeasurably, but it actually reduces the nuclear fallout of all future nuclear disasters. It does. Comment more on my videos. I've been chatting to you guys loads recently, and I've had some really stimulating conversations. You can follow us on Instagram, like our Facebook page, submit an episode idea to our email, which is psychforsoreminds@gmail.com. If you hit me up on Twitter, use the hashtag PsychSore. Please tell all your favourite people about Psych for Sore Minds, because they deserve it. Spread the love. Whatever you do, stay euthymic. And please remember, until next time, I love you.